Hi, my name is Varicocele and I'm going to talk about acute varicocele and renal cancer. Definition: a varicocele is a dilatation of the pampiniform plexus of the spermatic cord. This network of veins is dependent on the spermatic vein. Varicoceles develop as a result of venous reflux in the presence of increased venous pressure or defective venous valves. Although left varicoceles usually occur physiologically when one develops acutely in a man with no history of previous genital trauma, this raises suspicion of a retroperitoneal mass, usually renal cancer.
Is varicocele.
So varicocele is dilatation or dilated veins within the scrotum. In the way that the veins work, and we'll see in this diagram, you have the internal spermatic vein or the gonadal vein coming down, and those are the kidneys you see in the picture there, and they travel down to what's called the pampiniform plexus, which is that tangle of vessels you see in the scrotum. And when the valves in the blown up picture there don't function and blood flows the wrong way, those veins become dilated, and it becomes like a tangle of dilated veins within the scrotum. And that's what a varicocele is. It's a tangle of dilated veins within the scrotum.
Blood flows the wrong way. Now, I heard you use that phrase back in the first segment as well, and that seems to speak to the opposite of gravity and the opposite of the heart beating. How exactly does that happen?
So veins generally work passively by allowing gravity to push the blood back towards the heart, but there are small valves in the vein, and when those valves malfunction, the blood flows up and then it flows back down. So the valves that trap the blood and prevent it from flowing backwards, when they don't work, the blood flows backwards. And I think the veins don't have any muscle. They're very thin-walled. So if you think of like a balloon with no water in it or no air in it, it's a thin little membrane, but you see the capacitance, how much it could hold if you actually filled it up. And that's what happens to these veins. And in that diagram, I don't know if you noticed, but the vein on the left side was much bigger than the one on the right side. And that's traditionally what happens because the valve on the left side, for a number of reasons that have to do with embryology, tends to malfunction more than the one on the right.
Varicocele basically, again in the males, that is the enlargement of veins located within the scrotum, especially on the left side and along the spermatic cord. So they appear like a tortuous worms located within the scrotum when anyone feel it. Varicocele, generally it is very common, about 15% in men between the 15 to 25 years age. The exact cause is not known, however, it is because of the incompetence of these valves which helps in the unidirectional flow. Because of reflux of the blood from the abdomen into the scrotum, it is caused, just like a varicose veins of the leg. Varicoceles, generally it may not be detected because it may be asymptomatic in few people, and generally it presents. However, it produces dull aching pain and the enlargement of the scrotum in the involved site, and sometimes it may be painful with the over exertion or any stressful activities.
Applications in medicine. Most varicoceles do not require intervention. Adolescents and young men who have a varicocele and objective evidence of reduced bilateral testicular size may be offered repair. Treatment options include surgical ligation or percutaneous venous embolization. Although data are limited, some studies have shown improvement in semen parameters over 3 to 6 months and fertility after repair. Pros and cons. Pros. Its association with renal cancer is so frequent that such a development should be regarded as a sufficient cause for pyelography or other studies. The two most common surgical approaches are retroperitoneal, infrainguinal/subinguinal below the groin, and inguinal groin using percutaneous embolization. Varicocelectomy surgery improves testosterone production and may be a viable option in selected hypogonadal men as an alternative to permanent testosterone supplementation. Cons: possible complications of the surgical procedure include hematoma, hydrocele, infection, or injury to the scrotal tissue. Injury to the artery that supplies the testicle may occur, resulting in a loss of a testicle.
Varicocele has been can be treated conservatively one mode, and other things surgical open surgical procedures wherein ligation of the pamniform plexus and laparoscopic type of surgery, and the most advanced thing is the minimally invasive thing wherein a single prick can cure the varicocele through the transvenous approach and embolization of the gonadal vein, which is the most latest technique. Varicocele embolization is the most advanced minimally invasive therapy wherein venous entry can be taken either through transfemoral route or from the leg or from the transjugular approach, that is from the neck. So, once we enter into the vein, we will enter selectively into the gonadal vein wherein it is the main vein draining the these gonadal veins, and it can be blocked either by using a chemical called glue or cyanoacrylate, or can be coiled using a small coil, so that there will not be any reflux again going into the scrotum using multiple veins, filling the multiple veins, and hence it can be cured using embolization of the varicocele. Varicocele embolization is very minimally invasive. One prick entry of the catheter can be done through the venous approach, and it can be completed within 20 minutes to 30 minutes procedure in a local anesthesia, and patient can be discharged on the same day without any post procedural rest or any bed rest or any ICU management. Whereas traditional surgery, it will be done in the general anesthesia in the operation theatre, with the patient skin can be cut open, and then these plexus are ligated with the risk of other structures can be damaged and scarring. So, however, it requires also requires the stay in the hospital, hence it is compared to traditional surgery, embolization is very minimally invasive, scarless and painless, and very quick in and quicker procedure.
Issue applied in Ecuador, around 15 to 20% of all men will have a varicocele, and up to 40% of men who are evaluated for infertility will also have it. Although there are no defined statistics in Ecuador regarding the number of patients who present this disease, in a study carried out in 4,000 Ecuadorian couples in 2010 determined that 39% of the men analyzed had infertility problems. Conclusion: varicocele is not a serious problem, but it is a frequent cause of poor sperm production and therefore can cause infertility. In some cases, a varicocele can cause the testicles to atrophy and not develop normally. Thank you.